It's understandable that people want science to give them certainty. They want to know, if I do this, what will happen? We don't generally think that people can predict the future. But when we're told that the forecast is being made by this big, fancy technological device, it's tempting in a crisis to think that it's telling you what's going to happen, and to think that somehow choices that are guided by that are sort of virtuous and scientific and well-informed and, in some sense, morally neutral. In a wide variety of applications of modeling in general, in health economics, in pandemic mitigation, in climate science, you are using a model to evaluate an action that you might take and to evaluate what the likely harms and benefits of that action are. And I think it's had a pretty profound influence. In fact, I think this is probably the episode in human history in which computer modeling has affected the course of human events more than ever before. And that's in part because early on in the pandemic, we started contemplating pretty massive interventions. Many of these were argued for by using modeling, particularly a model developed by Neil Ferguson and his team at the Imperial College of London, which came out in the middle of March of 2020, and which tried to show that certain interventions that we might engage in and the absence of certain interventions would lead to massive differences in the number of people who would die from the pandemic. The degree to which it took center stage in decision making, I think, is the main way in which it was unprecedented. So we all know now, right, that this group brought their model directly to the Boris Johnson administration in the UK and had a very large influence on how the United States responded. And it was, I think, that was really quite unprecedented, that we were making decisions that affected virtually everybody's life in ways, in deeply profound ways. That was mostly guided by this kind of computer modeling. It was mostly guided by a kind of reasoning that went like this. Look, we have this model, and we can set the model to, business as usual, keep doing what you're doing. We can set the model to some intermediate strategy, maybe close schools for a few weeks, close large events, shut down maybe certain transportation networks, or we can set the lever to maximum suppression, right? Close all non-essential industry, close all restaurants, close all gatherings, keep schools closed. And we can use the model to tell us in really rather fine-grained and precise terms, right? This model was making not broad qualitative predictions, but it was making very detailed projections about what would happen in each of those scenarios, right, down to the number of people that would live and die. I don't think anything quite that dramatic has ever happened to human beings. The combination of the dramatic nature of the interventions being suggested, the essential role that the modeling was playing in that, the seriousness of the forecasts being made by the model. I mean, this was forecasts about hundreds of thousands, if not millions, of human lives being saved or lost. So I think it's hard to think of a case, a past case in history where a model was sort of brought out and said, look, I can tell you in an extremely fine-grained way what are going to be the consequences of the different choices that you might make. So people have been using models to try to both influence policymakers to do various things, and also to convince the public that the things that they were being asked to do or to abide were being effective. Pretty clearly, early on, COVID models left out costs. There's nothing in the model about what will happen to hospital systems if the healthcare workers' children are forced to stay home. There's nothing in the model about what will happen to the economy if some of these non-essential businesses are forced to be closed. There's nothing in the model about what the downstream effect of that will be on developing countries who are our trading partners. There's nothing in the model about what doing all of this will do to efforts to vaccinate children against preventable diseases. There's nothing in the model about what this will do to if you make people be socially isolated, what this will do to drug abuse, suicide. There's, of course, nothing in the models about those likely effects. One thing I think that's worth thinking about is who was involved in making these models and who benefited from the policies. So it's tempting to be overly crude about this, I think, but it's also quite dramatic the extent to which the people who did best during the pandemic, how much they were like the people that built the models. To realize that those of us who you might think of as being in the laptop class, right? Those of us who do our work at desks on the internet, how much better we fared in the pandemic than people who work in meatpacking plants or deliver us our groceries or live in parts of the world where the internet's not available. It's pretty clear that the people who did best during the pandemic, as a direct result of the interventions that were recommended by the modelers, resembled the people who did the modeling. So it might have behooved them to think a little bit about what it would mean for people unlike them to have schools closed, to think a little bit about what this would do, for example, to income inequality. It's not difficult, I think, to predict that if you close schools and you limit learning opportunities to children who come from families that are that have great facility with computers and the internet and who have the opportunity to stay home with their children, it's not hard to predict that those people will fare better than the people who, let's say, come from single-parent households that are racialized or whose parents keep the water running for the people in the laptop classes. It's not hard to predict that some of these interventions would exacerbate those kinds of inequalities. So it might have been more reflective for the people making those models to have thought a little bit more about how people impacted by those models would be different from them, and to then include in the models predictable results of the kinds of policies that they were recommending and how those results would impact people unlike them. We understand that the people who do modeling are going to come from a particular segment of society. That's unavoidable, right? I work in a meatpacking plant. I'm not the person who's going to come in and build your COVID model for you. But please, right, remember that we exist. And please be attentive to the fact that when you model the impacts of the interventions that you're suggesting, that you be a bit reflective about what are considerations that are going to matter to people who aren't like you. Suppose you're facing the decision of whether to close houses of worship in a community in which a pandemic is spreading. You need to be able to make the factual forecast of what biologically will happen as a result of closing the houses of worship and not. How much spread are you going to prevent of the pandemic by doing this? And what will be the downstream effects of this on people's health, on the healthcare system, on all the different sort of downstream possible places in which this spread could impact. all of the predictive juices of a model like that come from the choices one makes about what those parameter values are, right? So in other words, if you tell children they can no longer go to school and they should stay home, then sure, it's predictable that the flow of the virus among children will be reduced, but by how much? And particularly with a novel pathogen like SARS-CoV-2, these were not values that anybody could have claimed to have grounds for making precise estimates of them. So one of the things that I think people ought to have been asking early on when modelers came out and said, here's what will happen if you engage in this intervention or that intervention, is they should have said, do you know exactly what value you should have put in that place in the model? And did you, and this is the crucial point, right? I think, did you explore what happens in that model if you look at different possible values of that parameter, all of which might be equally reasonable? One thing we didn't know back in March of 2020, but we do know now, is that many of these models were very sensitive to those values in ways that weren't carefully explored. Now, was it reasonable to expect these modelers to have that all at their fingertips, 1 week into the pandemic when crisis decisions had to be made? Probably not. But was it reasonable for them to come back to us slowly over time and say, okay, we came out early with these forecasts, but in retrospect, we didn't explore the full degree of possible uncertainty for models in this, and now we're back to tell you that actually we're less certain about the forecasts that we made than we were before, and in fact, these range of possible values are consistent with what we know about how this pathogen will behave. If we had a perfect model, arguably we would have a duty to always trust it and to always make our decisions in accord with what the model said. But we don't ever have perfect models. And as a result of that, I think we have, in many respects, the opposite duty. We have the duty to treat always models as tools that we can use to help us reason about what our degree of uncertainty is about the world, to help us reason about how we should act, to help us reason about what the likely impact of our choices are, but never as pure surrogates for our own judgment and reflective decision making. But we also have to remember that for most people, the scientific process is relatively opaque. It's not realistic for even the most sophisticated lay people, or really even for the most sophisticated, scientifically trained people from neighboring fields, to have a full grip on what's going on inside the scientific machinery of a model that's being used to guide decision making. All models make forecasts or predictions or design recommendations or forecast the impact of possible interventions in ways that are uncertain. Models are imperfect. That is a fundamental feature of models, that they're imperfect and that they appropriately ought to be thought of as giving rise to uncertainties. Good modeling always involves some accounting of what a reasonable degree of uncertainty to have about a model output is. I think it's pretty clear here, in retrospect, looking at the modeling that was done early on in the pandemic, that insufficient attention was paid to what the uncertainties around these model forecasts ought to have been. It's important to remember that models can't be morally neutral, because when you build a model, you're confronted with two kinds of choices. You're confronted with, first of all, choosing what's going to go into the model. So you're choosing what to represent, and you're choosing how to represent it. And different choices about how to represent it will inevitably, produce forecasts that are going to look a little bit more optimistic or a little bit less optimistic. And the more optimistic it is, right, the more weighted it is towards a certain moral framework than another, and vice versa. So choices about what to put into a model and how to put it in there are always inevitably going to be choices that are better for one set of values and less good for another set of values. And being attentive to that, I think, is an essential feature of being a good modeler if what you're doing is building models for public decision making. At one stage in the pandemic, for example, the state of Nevada made the decision that casinos could stay open, but houses of worship were being closed. Now, there's obviously a kind of set of values one can have from the point of view of which that's a good decision. And so a decision-making process that is skewed towards keeping casinos open, closing houses of worship, might accord with my values better than someone else who thinks being able to go to their house of worship on the relevant day of the week is the most important thing in their life. There's no correct answer. There's no morally neutral correct answer about whether economic development or opportunities to worship are more important. That's something about which people can have legitimately different values. And any modeling enterprise that doesn't pay attention to the fact that there are a range of possible values one can have on this question is not going to be one that can be used for public decision making in a fundamentally fair way. COVID modeling has been the most morally and socially significant modeling in the history of human modeling. We have made decisions based on COVID models that have impacted lives all over the planet in unprecedented ways. It's not unreasonable for the people who don't resemble the modelers to want to stand up and remind the modelers, hey, I'm out here. My interests matter as much as yours. Please don't forget to incorporate into the model aspects that might make an intervention that hurts me quite a bit more than it hurts you look neutral. One way to think about how to mitigate that risk is to have some degree of public involvement in modeling. And I think it's pretty clear that we haven't had that in the modeling of the COVID pandemic. Most of this modeling has been coming out of isolated groups, producing models that were not even well understood by the scientific community. If the future is going to be like the last 2 years, where the response to any oncoming crisis is to employ models to evaluate strategies with enormous social significance, I think we need to think a lot more about how to make that reflective of a wide variety of public values. A lot of the ways in which public debate evolved in the pandemic was that many voices were told that they were not following the science. That was a phrase that we heard a lot early in the pandemic. We're following the science, you're not following the science. And I think in many respects that phrase, following the science, was used as a way of silencing other possible appeals to differing values than those of the people who were setting the policy. I think it's always important to remember that there's no such thing as a policy that follows the science. What there is there are desired outcomes and appraisals of the differential value of different harms and benefits, combined with what the science says about what different possible paths will result, and an uncertainty envelope around that. So if someone is telling you this policy follows the science, first and second questions you ought to ask them are, given what desired outcomes and given what weightings to different harms and benefits, and with respect to what consideration of uncertainties. And if those two other elements are not added to what the science says, then it's likely that legitimate debate is being silenced. Let's be clear, there are many cases where modeling can be used straightforwardly to guide decision making. There are cases where we have widespread agreement about what we're trying to achieve, what costs we're willing to bear, and where the models themselves are, the uncertainty that they give rise to is sufficiently narrow that the choices become obvious given what you're trying to achieve. When models get used by policymakers in ways that push them beyond their limits, or when policymakers use models to simply justify decisions that they antecedently want to make, I think there are two costs that we bear. One is that the actual decisions that get made in the moment could be bad for people. But the other, I think, that we always have to keep in mind is that science plays an incredibly important role in society. We want science to be available as a tool for guiding decisions, but it can only do that insofar as people have trust in it. And trust is a precious resource. Trust in science is a precious resource. And we need to be careful not to squander it by using scientific models as rhetorical devices rather than as genuine tools for exploring what we know and what our uncertainties are. Political discussions in much of the world have become quite a bit more divisive than they've been in the recent past. But I think we need to be careful not to try to always conceptualize that political divide as one that's taking place between those who are wise and who follow the science and those who want to deny science. I think ultimately we will pay a price in terms of the credibility that science will have if we continue to try to use it as a bludgeon for telling people we disagree with that they are the science deniers.